is Lindsay Hebert, and I'm a career consultant in career services. And today we have Ian Jones joining us today, who's the program director of the Master of Physician Assistant Studies program here at the University of Manitoba. And he's gonna kind of take it from here and give you all the information about the program going forward. So thank you. Welcome, Ian.
Hi, and thank you very much. I've been a PA physician assistant now for 24 years, and I've been the program director for the last 10 years at the University of Manitoba Master of Physician Assistant Studies. And I'm going to take this opportunity to welcome everyone to the session. If you have your cameras on, that's great. Make sure you stay smiling because we are recording it. And we have room for questions probably towards the end. And it's going to be a combination of some videos, some stories, and some facts. So feel free to take notes. And there we go. Okay, so the University of Manitoba has the only graduate physician assistant studies program in the country. There are roughly 260 programs in the United States, all of them at a master's level. And there's a few programs in Ontario at McMaster and University of Toronto that are at a bachelor's level, as well as the Canadian Armed Forces. I have put up our website, which is basically just physician assistant blurred together at the universityofmanitoba.ca. We have an email account, but be really careful about the emails you send them because the people answering can be really grumpy at times, and they always pass it on to me, and I know I can get grumpy. So, and I also have a Twitter handle, and I have been on Twitter now for about 5 years, and there's an entire PA medical education network, so you will find that entertaining at times as well. And there's several other resources. So first, I'm going to start off by playing a little video played by our students. And of course it failed. Let's see if this works. The video was produced by PA students from across the country in honor of our National Physician Assistant Day, which was November 27th.
Happy National Physician Assistant Day from the PA classes of 2022 from University of Toronto, McMaster University, and University of Manitoba.
Happy National Physician Assistant Day!
Happy National Physician Assistant Day!
Woo!
Happy National PA Day!
Happy National Physician Assistant Day.
To all practicing PAs, to current students like myself, and to all hopeful PA candidates.
I'm so proud to be working towards this career here in Canada.
A PA is a healthcare provider
who's educated in the medical model
and works alongside a supervising physician using a patient-centered focus.
And uses medical expertise and clinical judgment
in order to provide quality medical services.
I chose to be a PA because I wanted to be a part of this trailblazing profession that is expanding access to healthcare across Canada.
I met an Inuit woman in the Arctic that opened my eyes to the inequalities that are experienced by Canadians that live in rural areas.
And be accessible to our Canadian communities, to those who have immigrated to Canada, our Indigenous population, anyone going through mental health issues, or within the LGBTQ community.
I chose PA because of the novelty of this profession in Canada really excites me. I can only imagine its growth and how it's going to positively impact Canadians.
I chose the PA profession so that I can contribute to expanding healthcare services. To me, it's important that rural communities have access to local clinicians.
I chose PA because I want to be at the front lines of healthcare while being involved in a trailblazing profession that's improving access to healthcare for patients across Canada.
I would like to become a PA so I can help my population here of Northern Ontario.
I chose to be a PA because I'm excited to explore a variety of specialties with my lateral mobility.
I love working with patients, and as a PA, I can increase their access to healthcare providers. I chose to become a physician assistant because not only is it a career where I can practice medicine, but I can do so in a way that helps sustain our healthcare system.
I cherish the opportunity this profession offers to actively be a part of the solution to the inequities of access to healthcare in rural and underserviced communities like my own.
Being a PA will allow me to diagnose and treat patients, as well as be a patient advocate.
I had received care from a PA a few years ago when I had hip surgery. I was amazed by how my PA was able to increase the accessibility to care and also help me throughout the whole process from first consult to discharge.
I chose to be a PA because I wanted to be a member of this community of advocates across Canada who are providing exceptional patient care.
I primarily went into the profession in order to decrease the patient wait times and reduce the overall physician burnout rate in order to change the healthcare system for the better.
I chose to become a PA because of the flexibility that the career provides.
Enjoyed how they could be able to coordinate care and facilitate care between doctors and the rest of the interprofessional healthcare team.
I want to be part of the profession that bridges gaps in our current healthcare system.
I love physiology, helping people, and working collaboratively to improve patient outcomes.
PAs play an integral role in our rapidly evolving healthcare system,
providing high-quality care accessible to all Canadians.
Working with a team of healthcare professionals to provide the right quality of care by the right provider at the right time.
Happy National Physician Assistant Day. For more information about how physician assistants are working in the Canadian healthcare system, visit www.kappa-acam.ca.
And I'm hoping that I am back on. Am I sharing my screen? Okay, excellent. So, as a teacher, I like to put some objectives into our presentation. I think at the end of this session, everyone who pays attention will know what is a PA or a physician assistant. They will understand why you would want to be one. And hopefully I'll be able to tell you how you get to be one. So these are just some of the students that we've had in our class taken in here at the University of Manitoba. Primarily, PAs exist to increase access to healthcare, to reduce wait times, to improve the health of Canadians. So let me tell you a little brief story. When I was a new graduate, I took a job up in Skagway, Alaska. I had trained, had spent 15 years as a paramedic, did air ambulance, and then I went to university in my 30s and went to the Concordia University, then ended up going to the University of Washington in Seattle, became a PA, worked for a year in different emergency departments, gaining some experience. And then I took a great job in Skagway, Alaska, which is in the Panhandle. It's on the border between the Yukon, Alaska, and accessible by a 2-hour road trip down from Whitehorse, or a 4-hour boat ride out of Juneau, or a 90-minute air ride out of, so it's semi-isolated. 450 people in the winter, 3,000 residents in the summer, and about 15,000 tourists who get off the boats and walk out one side of the sidewalks, come back on the other side, then get in a train to view the real Alaska. Interesting place to live. My second night on call, I had a patient, a village elder, who was having some trouble breathing. His asthma had been going on for several days. He had been using his inhaler, but didn't want to come into the clinic because he didn't want to bother us. He was kind of a tough old guy. He was known throughout Alaska as a Elvis impersonator. He sung Elvis songs in Tlingit, which is one of the native tongues. Highly entertaining. And by the time he got to our clinic, I was on call. It's about 11 o'clock at night, and he's not doing too good. I ended up having to intubate him. That means placing a tube into his lungs and ventilate him. I asked one of the EMTs, the emergency medical technicians, to help me start an IV and get things going while I was busy ventilating him, and they didn't know how to do that. I had to teach them how to ventilate and squeeze the bag. I had to teach them how to, well, I started the IV and hook up all the medications. I pushed all the drugs. I was on the phone talking to a doctor in Juneau, my primary doctor, who was telling me, well, yeah, you got a problem. You better do something about it. I then contacted Whitehorse and said, I need to transfer this person out. It's at night. Helicopters aren't flying because, well, it's night and it's cloudy and stormy, and visibility maybe 10, 15 feet because of the snowstorm. Would you accept transfer? So they said yes. We put them in an ambulance, and I had left being a paramedic because I was tired of riding around in the ambulance. So my second night on call, I am back in the back of the box. I am ventilating a patient. My hand is cramping up. I'm getting my EMT to ventilate him. We are hoping that the pass isn't closed by a snowstorm and a blizzard and an avalanche that usually tends to go hand in hand. And then we got up to a spot called Carcross. The ambulance from Whitehorse had met us. We transferred him over, and about a week later, he comes back in my clinic saying, thank you very much. In that way that only Elvis can say it. Thank you very much. If you've never seen Elvis, you're missing something. Not much, but you are. And ask your parents. And it was an incredible experience. And I didn't have to buy breakfast for a year because he would keep beating me to the restaurant and order and pay for my breakfast as I walked in there. And that's one of the reasons why I love being a physician assistant. Of course, I was absolutely terrified, but it all worked out in the end. So let me take a swig of my coffee and tell you a little bit about the brief history of physician assistants. There once was a doctor who realized that he couldn't possibly do everything that was on his agenda. In the 1960s, technology started evolving. As you can see, the person's using, that's one of the older style computers that's running DOS, which is a digital operating system. The drives that go into it are huge, massive. But EKG machines for cardiograms were huge. They were basically pushed on a huge cart, and you didn't just carry them around as we do nowadays. In the early 60s, anyone who drew a blood, read lab tests, did any procedures had to be an intern or a doctor. And some smart people began to realize that a lot of the skills that are being done by physicians could be tasks substituted to somebody else. But that somebody else had to have some training and some qualifications because they were making a lot of serious medical decisions. They at first started with nurses, but the nurses union and association at that time didn't like being referred to as anyone's assistant. And so they needed another option. So they looked around and they found retired military personnel, veterans who had experience as corpsmen from the Vietnam War. They had extensive training, but they couldn't use their training in civilian practice. And they also started looking around and they realized that there were a lot of real smart people going to universities, taking science courses and arts courses and knowing how to communicate. They were being taught psychology. They were being taught the sciences. And they wanted to do more, but not all of them wanted to become physicians. Because face it, if you want to spend 4 years going to medical school, 4 years as a residency, being $250,000 to $500,000 in debt at the end of it, go ahead. It's not for everyone. They also had paramedics. They had lab techs, they had x-ray techs, they had a lot of experience doing their jobs. They had nurses who had done their jobs, but wanted to do more for the system. So they developed an educational program based on the Second World War medical training, where they took the 4-year physician program and they reduced it down to 18 months. They put them on 6 months of education in hospitals, and then they sent them overseas. And so Eugene Stead and Charles Hudson and others, physicians, took that program, took people, smart people with experience and academic smarts, and they made them physician assistants. And physician assistants have been supporting physicians and patients for over 50 years now, 55 years to be honest. The Canadian military here used PAs in replacements of physicians because, well, there weren't enough physicians to go in the combat zones and overseas duties. So they developed the PA model. First PA I ever met had been working at the University of Alberta since 1983. The military started using the title physician assistant since 84, but they've been trained in the Korean War to provide primary health care to the soldiers. And then gradually they started advancing the training and education to match what was being taught elsewhere in the globe. So, physician assistants are academically prepared and highly skilled medical practitioners. We practice generalized medicine and we work in collaboration with physicians. Now, you'll find PAs working in surgery services, in medicine, primary care. We do pediatrics. We do the whole gamut of healthcare. We're in different areas. And we have a philosophy, and one of the things that makes PAs, physician assistants, makes PAs who we are, is that we believe that the health of humanity relies on human care for all. So open access, quality care. We also believe that if we elevate the health of every community, we do that one person, one day at a time. We do that by developing trust with our patients, building relationships, improving access to care. We have a team concept, but yet we have autonomy in what we do because we do what we know. And when we don't know it, we're comfortable saying, I need help. So we believe in quality care. We believe in quality of practice. And we have a trust with our patients, but also our relationship with physicians is built on trust. Our ability to do what we do is because we focus on building a trusting relationship. Okay, so what PAs do is we provide patient-centered care. We examine patients, we make diagnosis, we prescribe, we perform, we treat. We practice medicine. And we do this working alone or in teams as a member of the medical staff. I like to describe it as we have a collaboration with physicians. So some of the tasks we do, we can work in the operating room. We can perform a surgery first assist. We help educate patients in everything from smoking cessation to reducing alcohol intake to how to sleep better, how to deal with the anxiety and stress where every single class you're going to is on Zoom and nobody really gets to know you. We work in oncology, which is cancer care, psychiatry, neurosurgery, internal medicine, nephrology, cardiology, 32, 34 different specialties in Manitoba alone. So the bottom line is that PAs practice medicine. That practice can be remote. We have people in Thompson and La Paz. I have colleagues who are working in the Northwest Territories on diamond mines. Some good friends of mine are working on the Canadian submarines and on ships that are scattered around the world. We're in, you'll find PAs who are on the forward operating bases in Afghanistan. We have PAs as a sole provider in communities here in Manitoba, where their support is through phone to their physician supervisor. But we're also team players. We work on a lot of different teams. The young lady is smiling at us is Maureen Taylor. Maureen is a former journalist who worked for CBC, who went to McMaster's and now practices infectious disease in Toronto. She has been involved with medical assistance in dying programs. She is using a dog to help sniff out C. difficile, Clostridium difficile in hospitals, which is quite a deadly disease if not properly treated. She is working with COVID patients and does quite a lot. Then we have people who are working on transplant teams, doing liver transplants, kidney transplants, which is really team medicine. And there's a combination. We're working with the respiratory therapists, the nursing staff, the physiotherapists, the occupational therapists, the surgeons, and it's a big team. And then the PA works to communicate and connect with individuals. Then we have, surgical teams. Here we have PAs working in plastic and reconstructive surgery, cardiac surgery, neurosurgery, general trauma, orthopedics. So most of the teams have them. So we practice medicine as a generalist, and we develop knowledge of a specialty over time. We're flexible and we work in any clinical setting. Our role is primarily clinical versus doing a lot of research. We are taught the basics of research, but usually PAs are known for being clinicians. We assume the roles of leadership in a practice or organization, doing a lot of quality improvement and assurance. What we do practice, our scope of practice mirrors that of the physicians we're working with. We believe that our practice needs to be collaborative in nature with a focus on patient care. And one of the great things about it is that we have this horizontal mobility, meaning that you can start off working in family medicine, primary care, and then go to work in surgery. You don't have to write new licensing exams. You can start off in pediatrics, and then when the parents of pediatric patients drive you crazy, you can then transfer to geriatrics, or you can work in, myself, I have worked in emergency medicine, addiction medicine, correctional medicine, neurosurgery, and now I'm an educator. In Juneau, where I worked for 6 years, I would start my morning going to the jail, and when they let me out, I'd swing by the addiction recovery center, then I would go into the emergency department. So it was a chance to see all my friends and everybody I knew in general. So it was a great job, and I truly love it. So what you really want to know is, how do we train you? So the Master Physician Assistant's curriculum is 25 months. That's continuous. You get a 4-week break during the summer, get a couple weeks off at Christmas. It's stressful, It's intense. It is pretty hard. And that's why we spend a lot of time choosing who gets into the program. The first year is science and medicine classes, a combination of clinical learning opportunities, but mainly it's a didactic or academic coursework. The year 2 is the fun year, and that's clinical experiences, where you're going out in the hospitals and the communities. We are a very small program, the smallest probably in North America. We have 15 students, but we have large support from our community. It was an anomaly that we had the majority or all the students in this one particular class were female, by the way. It's not always like that, but I care more about academic performance than gender stats. And besides, I know that women are smarter anyway. So the community has embraced the PA, so we don't have problems finding instructors. We're able to place people in a lot of different areas and doing a lot of different things. So our academic program is one that builds on medical sciences. You have to have certain core skills before you get in, knowledge of biochemistry, physiology, and human anatomy, but then we'll teach you everything else. Our curriculum emphasizes critical thinking and problem solving. So our first year, we have another class in anatomy, and we use cadavers. We have pharmacology, a very intensive pharmacology program. We do a lot of physiology and pathophysiology. We introduce you to genetics. It's a very small course, but it's medical genetics, which is different than general undergraduate genetics. We teach microbiology, infectious disease, and we keep stressing the biochemistry of life. These life sciences are combined with things like professional studies. So you learn what a PA is. You practice the elevator speech. You learn about ethics. You learn about the legalities of practicing as a PA. You have the opportunity of taking classes in emergency, psychiatry, adult medicine, pediatrics, and obs-gynae. And we really focus on patient assessment. Our bread and butter, what physician assistants are known for, is we lay our hands on patients. We touch skin. We basically listen to lungs. We listen to hearts. We look in eyes. We examine the mouth. Put a finger in every orifice. We are really good at doing histories. We basically are clinical learners. We know how to assess a patient. We know what's going on with them because we've studied the normal, and we practice medicine with those who have interesting symptoms. And that was just the first year. Our second year, we do our rotations in areas like internal medicine, either at St. Boniface or at Health Science Center, where the sickest of the sick in Manitoba end up. We do 6 weeks in emergency medicine, 6 weeks in surgery. We try very hard for at least 1 week in plastic surgery, so we learn how to suture and how to reconstruct and take care of wounds. Our program does 3 months in primary care, which is family medicine or community medicine, where we would spend time in geriatrics or in rehabilitation. We do 4 weeks in pediatrics, women's health, obstetrics, and gynecology, where the students deliver babies and learn how to take care of 52% of the population. We do psychiatry, And we have some electives. The electives can be whatever your interest is in. If you want to spend more time in plastics, we can arrange that. Or if you want to do figure out if cardiac surgery is better for you or maintains your interest, we can arrange that, or infectious disease or radiology, or these type of areas. So I believe we have a very well-rounded, broad-based generalist program that prepares you for whatever job you go into. Because even working in surgery, the surgeons are the ones who are doing the surgery, and the PA is maybe first assisting, but the PA is managing the patients when they're in the ward or doing the assessment before they end up in the operating room. So yeah, it's pretty good. So what do you need to become a PA in the University of Manitoba program? You need a 4-year bachelor's degree, minimum of 3.0 GPA to get in graduate school. But to be perfectly honest, if you don't have a 3.5, you're going to really struggle in our program. It's an expensive program, so if you aren't a good student, you'll suffer and you'll lose your tuition. So we spend a lot of time making sure that the people who get into the program are qualified and capable of managing the curriculum. So having a good science foundation is important, but we also know that humanities and the arts are valuable. We've had graduates or people who've come into the program with degrees in commerce, fine arts, theater. They have geneticists, microbiologists, people from with anatomy degrees. I don't think I've had a history major yet, but they're out there. So we recommend microbiology and psychology as a course because, well, understanding about germs and cell structure is kind of important, but also understanding how people think and how they react is what you do with psychology is good. We've changed the rules so that now you'll only need 2 current references on your application. And we're looking at people who have life experience. We like people who know how to play on teams. We like people who realize that there is more to life than just simply the hallowed academic halls of a university. We want you to have some real world experiences, meaning you've worked in extended care facility, you have volunteered in a food bank, or and the list goes on. You've babysat or supported children with disabilities. We're wide open, but you need to have done something more than just gone to school. So, all right. Our application deadline is January 15th. You can apply if you're in your 4th year of university. It is a graduate studies application process, meaning that you have to meet all the University of Manitoba's graduate studies requirements. We use a situational judgment tool. The one we're currently using was called Casper up until about a week ago when they changed the name to something else called Altus. And what it is, it's just a series of questions on judgment and ethics and morality, and how you interact with people. And we use it just to help identify the people who are coming in. There's always secondary implications of a test like this. One, you have to be able to type quickly. You need to be able to think on your feet. Due to COVID, we're not likely to have a multiple mini interview. Even so, some programs are doing it online. We're focusing mainly on panel interviews right now. You need to be able to write a statement of intent now. What that means is telling us who you are, and why you want to be a PA. What is it about the profession that you really admire? And what do you think you could bring to the profession? You need to understand your reasoning for being a PA. And it's more than just simply helping people, because teachers help people, career mentors help people, crossing guards help people, and all of them have value. So there's got to be another reason for it. And you got to ask yourself, why do you want to go through all this stress to become a PA, where you're never going to be the person in charge, unless you go into education, and then, but you you work with other people, which if you have a strong independent streak, may not be best for you. So you need to understand what the profession is about. And I think paying attention to this talk, I might have helped you on that one. In summary, we want to know who you are. You need to provide 2 references so that somebody else will tell us who you are. And you need your transcripts from every academic facility you've ever gone to, even if you were only there for 2 courses. If we find out that you attended someplace to take a course but didn't enter those grades, you will and didn't provide the transcripts, you will immediately be disqualified. So these type of things are really important. You can find all those admission studies or admission requirements through the University of Manitoba medical education academic requirements. We can make accommodations for certain things, but if you don't like touching people, we can't change that. If you need extra time to write a written exam, we can provide that, but you don't get extra time to actually do patient care. So those type of accommodations are really, really possible. We're interested in people who have physical challenges, and we want to make the program more diverse, as something that we've been trying to do for a long time. So who gets into the program? The age is between 22 and 47. The average is 29. They have a GPA better than 3.7 on a 4.5 scale. This last year's class was sitting at a 4.1. But, that's an average. I mean, it varies. People in the 3.5s have gotten accepted, 3.4. The majority are from Manitoba because we are a Manitoba program. 50% have had healthcare or research experience. A third have a graduate degree, but that's not essential. Most have team sports experience or research team experience, or have worked on some sort of team, because that's what PAs do. Our PAs are working in 32 different specialties and in 4 provinces. Alberta has just announced that they're going to be regulated for the PAs in April. There's I think we have 15 of our graduates working in Alberta. Ontario has about 70% of all the PAs in the country, and we have, I'm pretty sure, close to 15 of our graduates working in Ontario in different areas. Nova Scotia has just started a pilot project, and they will probably be hiring PAs in a few years. And we have a graduate working in New Brunswick, working in the emergency department. So it's a slow process in the country, but it's happening. It's the opportunities are there, and there's need in Manitoba. All the PAs from the Manitoba program who have been looking for work are employed. The longest anyone has had to wait was 6 months. And they actually had turned down 3 jobs, so because of the drive and the commute. So I don't really count that person as being a delayed entering the workforce. So the job market is there, but I can't promise you it's going to be there in a year or 2 years. But by that time, some of us will be retiring, so there will probably be even more jobs. So, okay. The University of Manitoba Master of Physician Studies educates outstanding clinicians as medical generalists in service to our communities in Manitoba and Canada. We nurture the future leaders of the profession, and we do lead the field in academic preparation of PAs in Canada. We have a journal. We have PAs who have published a lot of papers from our program. We write, we have developed the regulations first, and we use our regulations wisely, and people model what they're doing in Canada and what we have done. So I'm going to open up the floor. So do I have one more? Yeah. Yeah, I do, but I'll save that to the end. So if you have any questions, well, keep those cards and letters coming.
We actually have one in the chat here from Sarah. She's wondering if the GPA stats that you mentioned were based on the cumulative GPA or the most recent 60 credit hours.
You have to have a 3.0 better in the last 60 credit hours to be even reviewed. And when we have 15 applications for every one, we try to look for a cumulative GPA, but it's a trade-off. If you have a unique life experience, or you write an incredible essay, or if there's something about your history that we're seeking and looking for, we have some leeway. So when we put out a cumulative GPA, it's a guideline versus a hard, fast rule. Okay, but if you're struggling through university with a 3.2, save your money. You will not survive the first term of our program. The PA shadowing program was temporarily stopped. I'm working with a group called Parsec Live. Parsec is physician assistants for research scholarship education in Canada. What we're doing is we're providing a virtual shadowing experience, and going up on our website, we will have interviews with a pair of PAs. We just finished a delightful session where we talked to a PA in Thompson, Manitoba, who worked in the emergency department, and one who worked, blanking on the name, about 2 hours outside of Toronto, a community, I think that's commuting distance to Toronto, by the way. But he's working in a community outside of Toronto in the emergency department. In a week, we're interviewing 2 PAs who are working in industrial medicine in the north. And the month after that, we'll be interviewing possibly either some surgical PAs or some internal medicine PAs. So we're trying to provide this out there. We're not requiring shadowing experience for this intake, but knowledge of the profession is out there and available. Oh, don't know what to major in? Oh, great question. Lindsay, you have any suggestion?
Well, I mean, that's there's a lot of different directions I think we could go with that. That might be more of a conversation for me to have with Era directly. But I mean, even for this program, I think you mentioned that really there's a diversity of options that might be a good fit. If it's more kind of deciding what might be a good fit for this program, I think you outlined pretty clearly that some science background could be helpful, but that you're also pretty open to any program, right? So
yeah, absolutely. I mean, the person who came in with We have somebody who had a degree in political science and had taken the core courses, which means that you have to build up your chemistry level. And that has really value because, you know, PAs have to be political. Being able to write and taking fine arts in English is really important. You know, STEM is this, oh, let's see, I've got a pharmacist, engineer, teachers. I mean, we're wide open because medicine is about people, not just purely about the science.
I think one year that I was in one of your classes, I saw there was everyone, there was a nurse, there was a dietitian. I think the one year that I might have been in there for sure. Those, I know I remembered having I've talked with a lot of students coming from a variety of backgrounds that, you know, thought they wanted to do, like I mentioned, dietetics, and then tried it out a bit and thought, no, this isn't really what I wanted. I don't want something quite so specialized, I think.
Yeah.
So.
Yeah. There's a great question regarding biochemistry.
Yeah.
The University of Manitoba wants you to have 3 credits in biochemistry. I don't care if it's lab. I just want you to have biochemistry. And there's a couple of reasons for that. Is that biochemistry in general will teach you how the body works and the feedbacks. It's a combination of life and chemistry. So if it has a lab component, I don't care. If it doesn't have a lab component, I don't care. If you are a pure organic chemist and you have all those components, you still need biochemistry because, well, what we do and the way the drugs we push has a lot of biochemistry in it. And we have found in our history of the program that those students who have no biochemistry suffer during our pharmacology and our internal medicine and our physiology courses. So we've put it there to help provide a foundation of knowledge. I don't care if it's online. I don't care where you take it, as long as you got 3 credits. Okay. Rural medicine. All right. Yeah, rural medicine. That's a great. What is rural medicine? I came from a town. I worked in a town of 475 people. That's, to me, is rural. And yet we were on the road system because we had a boat that came in one way and a highway that left the other. Other people define rural as, you know, the only way you get into it is by plane. We have PAs working in La Palm, Thompson. We have in God's Narrow and the First Nations communities. The small towns, the biggest obstruction right now is the funding for PAs, where a primary care physician in a small town works by fee for service, meaning that they make money by seeing patients. The current laws in Manitoba does not allow physicians to bill for the services provided by somebody else. So they have to be involved in it. So it kind of restricts how PAs can make money. We are working hard to get this changed. And now the Master of Physician Assistant Studies is in the Department of Family Medicine. We actually have a stronger lobby group. We had one community that had never hired a PA before, but because of COVID, they now have a team of 3 full-time PAs managing all their inpatients. They're not likely to get rid of them. Steinbeck had 1 full-time and 1 part-time covering the weekends. They now have a team of 6 full-time PAs managing their hospital. It's pretty good future. You know, when death and destruction rain down around us, and people who have services that can move from one area to the other, you begin to appreciate how good the generalist training is, because we've been able to transfer people from urgent cares into intensive cares and from surgery services into hospital medicine. and people are moving around to meet the needs. PAs have to have a supervising physician. So if a small town is looking to hire a physician but has the funding but not able to, the government has allowed them to transfer funds to nurse practitioners or to physician assistants. However, they need to be able to provide a supervising physician as well. So depending on the community, and the other concern is that these small towns would like to hire a physician. So if they use that money to hire somebody else, like a PA, that money disappears. So it's not always good for the PA, and the PA has to have a long-term contract. But hey, I worked in a town and my supervising physician was available 90 air miles away in a small plane flying in the Alaska mountain chain. They didn't come up to visit me too often, but I always had availability through telephone, satellite phone at least. So, all right. Is a snapshot required for CAPS? I think it is, but we in the program don't see it. We are trying really hard to eliminate any requirement that could leave it open to discrimination. What it means is that we need your names, but I don't need to see a picture. We don't need a passport, anything like that. The Casper online exam requires it to verify who is writing the exam to match up to your ID. But the programs who get the results do not see that photo. And I'm not interested in seeing the photo because I use a wide team and sometimes images can be misinterpreted. So there's a lot of tricky components to this.
Sorry, Eve, can I just jump in with one more question that I had a couple questions received just via direct messages before we go too far down. A couple students were wondering about if there's certain things that PAs are not allowed to do, and trying to get, I guess, what would be a physician doing versus a nurse doing versus a PA. I think they're trying to understand that distinction a little bit more clearly.
It's referred to as a scope of practice. And in Manitoba, PAs are allowed to perform all the reserved acts that their physician supervisor is performing. So for example, I worked in neurosurgery and I was able to put in twist drills and burr holes and help in the operating room. I did lumbar punctures and everything. But if somebody came onto our service who was pregnant, I could only handle their brain. I wasn't allowed to do anything about their obstetrics because my surgeons were not practicing in obstetrics. If something in an emergency happened, we could do it, but it wasn't part of our normal scope of practice. The same thing, that's one of the reasons why they do these consults. We're trained as generalists and I've delivered, I think my count is 18 babies. But I wouldn't be allowed to take care of somebody having a gynecological or obstetrics issue on the neurosurgery service. As in somebody who's working in obstetrics couldn't practice brain surgery. Probably for good reason. So on both sides.
Perfect, thanks.
Volunteer experience. As long as you're taking care of other people or helping with other people, it's good for me. Church volunteers, shelters, Nobody Dies Alone, where you read, walking dogs may not count it, but we're kind of wide open. Stats, we average, right now I think we're at 14 applicants per every available position. The best it's been was like 10 to 1, but most years it's around 14 or 15 to 1 position. A degree from another country. If it's recognized by the University of Manitoba, yes, it is considered, and we'll take a look at it. Yeah, we have a lot of international medical graduates who apply for the program. The issue is they don't understand what a PA is, and it creates some problems and difficulties. So we consider each applicant individually. Average age being 29, it is not unrealistic for a student to apply after their undergraduate or in their 4th year. The youngest person we've had was 21 when they applied, 22 when they started the program, and I don't think they're even 30 yet, but they had a very impressive CV and resume, and were listed as one of the 30 under the age of 30 in Manitoba making a difference. So yeah, the oldest I've actually had, I had somebody apply for the program who was 67 years old, had an engineering degree, had retired, and wanted to learn some medicine in order to keep working in engineering on different applications. Since he would be 69 when he graduated, and he also was lacking some of the core courses. He didn't have a biochemistry course, so we couldn't accept him. Okay. Any tips or advice on writing a strong application, supplemental application, or statement of intent? You need to write it yourself. You need to understand why you want to be a PA. We provide 4 questions for guidance. Once you finish writing it, you put it aside, and you come back and you read it again. You make sure that the grammar is correct. You use tools like Grammarly or whatever works. You read it out loud, you go back and re-edit it, you have somebody else read it out loud, and you go back and edit it. A good supplemental application statement takes about a month at a minimal to write. You are selling your soul. I'm not going to say the devil, even though people have called me that. Maybe they say I'm devilish, but that's beside the point. And if you're not prepared to explain why you really want to be a PA, we have too many other people to take a look at. It has to be a university level course. So Red River College Anatomy and Physiology is not, if it can be transferred to the University of Manitoba, it's good. But there are certain levels of courses. So if it can be applied towards a degree, it's recognized. Any anatomy course from the University of Manitoba, as long as it's human anatomy. All right. Kinesiology has a whole lot of them. A zoology or comparative anatomy course doesn't work. It has to be a human anatomy. And you find this out by, if you look at the course description, it will usually have a reference to humans. Okay. Correspondence courses like through Thompson, Athabasca, their anatomy courses are recognized. There's a few others. U of T has a really, really expensive one, so maybe consider somewhere else. But you don't need a lab for it. You just need the anatomy. Different introductions for human physiology. As long as it says human physiology in the description, we'll consider it. Yeah, honestly, any questions regarding Casper on the process of doing it? you're best going to their site. The program does not require photos. Tutoring younger kids is very valuable. What is the difference between a master's program and the bachelor programs? Master's programs teach critical thinking, clinical analysis. We have a research component. We require you to do a capstone. We expect you to be adult learners, in that not everything you learn is going to be spoon-fed to you. You need to be able to go open a book and read it yourself. We have a strong course, we have a strong curriculum, but we're not able to teach you all the answers. So we're also 90 credit hours, or 86.5 or something like that. We're a pretty intense course. We spend about 35 hours in the classroom versus McMaster's, which is a problem-based learning, which is they average 15 hours a week in the classroom. And University of Toronto is a flipped classroom approach with courses and assignments, and it's by distributed education, as we all are, but right now. But so best to look at what they say in the program. University of Manitoba provides all the clinical placements and rotations. U of T and McMaster's have 3 to 4 month electives where you have to find your own sites. So there are some differences in the structure of the program. Pass rates on the national exam are all within 4%. So you can learn, if you are a strong student, you can learn to be a PA from anywhere. Prerequisite courses: if you are enrolled in a course at the time of your application, you have to provide your enrollment, like a confirmation of enrollment, but you do not need their final grades until May of the year that you've applied. What's the difference between a rural applicant and a Manitoba applicant? Well, we have people who are applying from Ontario, from the Northwest Territories, outside of the metropolitan areas. They're considered to be rural. So you can be both a rural Manitoban Indigenous applicant and check off 3 boxes. And it just means that we pay closer attention to your application. Okay. Yeah, we do recommend references from 2 different places. There are lots of online suggestions about supplemental applications, but I read roughly, well, 150 plus a year, and I've been doing it for 10 years. I can spot if you're copying the format from somebody offline. I run every single application statement we have through a plagiarizer. I have rejected students because they just cut and paste from an online site. So you're better off just reading it, but not using it as a template. You got to be honest about yourself, okay? I know it's tough, but originality counts, and you're talking about your personal life story. You don't need to copy it from somewhere else. People are truly amazing if they think about what they've done and who they are, what their family history is, what the differences are. Okay. Our first year of the program is 56 total hours, 3 full terms. We start the first week of September and we finish the last weekend of July. Okay. All right, let me take a breath. Everybody enjoying the show?
I know that one person had mentioned here, they're just finding the application bulletin, which I think you had mentioned, you had the link somewhere in your presentation there. I'm looking for it as well. I'll try to paste it in the chat here as we're.
If you go to the UManitoba / physician assistant site,
yeah.
If you look under prospective students,
okay.
It opens it up and there's like 3 or 4 documents. There's an admission bulletin, or there's something about the program. There is a mission bulletin, which basically says what the requirements are, what the statement has to answers a lot of the frequently asked type questions. And then there's a frequently asked questions. I would highly recommend that before you apply, you sit down and read it, you think about it, and then you read it again before you start sending any questions in. We spent a lot of time trying to explain what is needed. It's a sign of people's ability to comprehend written instructions. It's actually one of the tests, is if you can figure it all out, you're more likely to survive the program. I mean, I started saying that as a bit facetious, but it's actually true. Okay, has the pandemic changed any of the in-class program delivery? Well, yes. The program is online right now, so we're using Zoom. But we do have clinical and procedural experiences where, because we're such a small size, we're able to bring 15 students in personal protective equipment, meaning goggles, masks, gloves, and gowns, and we teach patient assessment. The nice thing is that if we can teach you how to examine people in full personal protective equipment, then you're going to be better off doing it in the real world. We teach you how to drape and how to cover people so that you can examine them while protecting their modesty. But we're doing it on each other, on our students. So if you are uncomfortable flashing skin in front of your colleagues, you might want to think about the job, because the only way to learn what normal is to see what normal is. So if there is religious things, then you talk to me, and then we will make accommodations, and we'll make arrangements so that we can do it, but you still have to demonstrate the minimal requirements of the program in order to pass. And that means being able to walk into a room with a total stranger, initiate a conversation, and examine them. That means listen to their hearts, their lungs, seeing how their joints move, seeing how their skin is. It's really hard to teach dermatology exam if you don't see their skin or you're afraid of looking at them. So, okay, panel interview format. Type of questions are behavioral, related to CanMeds. We're looking for communicators, collaborators, professionals, scholars, leadership skills. We do not ask about medical expert type questions. We're going to ask you questions about advocacy. We're looking for problem solving skills. How do you resolve conflict? Morality and ethics are always good. So how do you answer the questions? Is Career Services has a wonderful series of books on how to write a cover letter, how to write a CV, how to answer an interview question. They talk about the using your education experience, the situation and the problems and the resolution. They use a whole lot of hints on how to approach interviews. Highly recommended, even if you're not applying for their program. Career Services are really good. I basically copy and send it off to a whole lot of people.
Thanks.
Yeah, it's a good plug, right? No, okay.
Yeah, thank you. I'm just typing that into the chat there.
Link to the program page. Sorry, there's a question, a live question.
Yeah, no, sorry. I'll turn on my video so you can see me. So I was just wondering, like you sort of touched on how things have been affected by this pandemic. I know my sister is a PA. She's in a couple of these pictures actually. And she's sort of been thrown into a different role. I'm wondering just sort of what your thoughts are with other health professionals being redeployed and the unique opportunities that PAs are being put into in this pandemic. Do you think this setting will set the stage for future opportunities in areas that traditionally haven't utilized PAs widely?
Well, I can tell you that on my Twitter account, I'm now being followed by the Minister of Health, by Dr. Rusin himself, who didn't even know I existed 6 months ago. And if they're paying attention to me, then they're paying attention to physician assistants. Okay. I think the PA model with a unique ability, well, a few years ago, the beds in the hospital at the health sciences were being filled with patients who had been admitted because they had influenza, but couldn't be discharged because the long-term care homes and facilities didn't have enough beds open. So there was a backup. Patients had come from the community, had been admitted, been treated, and then were in a holding pattern before they actually went out back to their sites. Because surgery services were shut down because there weren't enough beds for elective surgery patients in hold. For the PAs were reallocated and moved from surgery, from orthopedics, urology, general surgery, and assigned to the, they refer to it as the elder ward. And within 48 hours, 2/3 of those patients have been discharged because the PAs knew how to pick up the phone and call people and how to get the paperwork done. Our health system opened its eyes and went, oh, wow, that's impressive. And we have more and more PAs being hired and employed on hospital services because we teach how to communicate and how to adapt, and that our generalist education, our foundation of education, is directly transferable to anywhere you have a patient. We have a psychiatry service that went from having 2 PAs to now having 8 in the space of 3 years because of PAs. Not only are we in the crisis response center, we're also on the inpatient units at the VIC. We have PAs who were seldomly employed in family medicine, to now that we have, I think the count is now close to 20 PAs who are now working in family medicine sites, partly because of COVID, but partly because PAs are good and people are getting kind of happy about having this. So, yeah.
Thank you.
Yeah. Thanks for letting me preach. The gospel according to Ian. Okay. Does having work or volunteer experience in a healthcare setting give anybody an advantage? On our matrix of scores, it might add a point, but I think we have over 100 points that we assign to different things. So having a couple points in a healthcare setting, if all things are equal, might give you an advantage. But having a couple points working as a health aide will work, but also getting points from somebody who's working in mission also gets you a point. So we try very hard to look at the whole person versus just the surface.
There was one question back here about, I guess, final official transcript deadline perhaps being a little bit later this year because of the late start, I guess, next term with COVID.
Oh yeah, that's right. The term doesn't even end until January 15th.
Yeah, it's a bit later. Mm-hmm.
Quite honestly, if people apply, I'm going to be taking a look at it. If you get a pass or fail grade, I'm going to take a look at your transcripts. You know, we have a saying in the program, our unofficial motto, if you read the UM Today newsletter, is change, adapt, achieve. I am quite willing to adapt to the current situations to find interesting, qualified people. The program have had people who have applied multiple times in the past. I currently have a student who applied twice and then took 5 years off to get a degree, get some work experience, to grow up, and has applied and is currently in the program. So yeah. And microbiology course, but didn't do great on it. Well, if you've taken a course, you need to put on your application, but microbiome, yeah, I would put it on there. We do not take points away. We add points. So, but if you have a microbiology course and it's a recommended, you will get a point. If you have a honors mark, you get more points. So when you have well, last year we had 179 applications. Every point can make a difference, but we never punish anybody for being honest.
Anyone else have any questions? We're getting close to, I guess, the end of our time today. Oh, one more here. Having any bilingual advantage?
Yes.
Does that add points?
Does it add points? It is not a program requirement. Being able to speak more than one language is flagged, and that includes American Sign Language. Yeah. You know, one year I asked the students how many different languages they spoke, and we had 12 students, and we tracked 30 different languages in the program. This is Manitoba. Diversity comes in a lot of different manners. I mean, we have an incredible province in what people bring to the table. And we try and recognize it, and it makes the job really difficult because we have all these incredible people. Yeah, sometimes it's, oh yeah, the thing about the jobs. This is a very interesting year because we had the province. The way the process works is that services ask and request a PA. The current government wants to ensure that the job is necessary and that there is available funding. When the job is approved, it then goes up through at least 4 different levels, and then it sits in the Treasury Board. So if the Treasury Board is busy trying to figure out other funding priorities, approval for a PA job is pretty low on the list. So it varies. And the other aspect for the delay in the jobs is that because of COVID, they knew they needed PAs, but they were trying to debate where the best place for them. For example, the Access Care Centers have a COVID testing unit. They've employed 4. Part of the problem that they were having was that cardiac sciences had vacancies from previous years, but also general surgery had vacancies. Some rural communities had vacancies. And so there was so much need that there was a decision freeze Like nobody was prepared to make a decision and saying, this is what we're going to use them for. So yeah, unfortunately, the student suffers. It also accelerated our education program to meet the demand because they were saying that we had so many PAs, or so we had so many jobs that needed PAs. They asked us to get the program through a month faster. Because we were able to do that, the issue was they weren't ready for us. So yeah. Anyway, I want to thank everyone for their time and their interest. It would be more enjoyable having a classroom full of smiling faces with my being able to bring some of my graduates and some of my other students in to help answer your questions. But it is what it is. So I'm just going to conclude by saying, stay safe, wear a mask, wash your hands, and take care of each other.
Absolutely. Thank you everyone for coming. We were so happy to see so many students registered. Hope you learned a lot, and absolutely check out the career services resources online. And we have lots of different sort of chats like this where we feature different professions and different programs and things like that. So check back on Career Connect to see what else, what other sessions will be upcoming. And we'll have a whole bunch where we'll actually feature this program once again in February again during our Discover Your Future in Healthcare series. That will be coming up between February 12th and 19th, somewhere in that range. So if you'd like to see Ian on, rerun again of Ian today, and some other good information as well, then you can join us again in February, as well as lots of other options. So thanks everyone. Have a really great rest of the day. Take care, stay safe.